One of the big challenges we've had in healthcare is we've never been able to introduce the Baumol effect.
Today, in every corner of the summit, someone is speaking about sustainability, which is why I'm very excited to dig deep with my esteemed guests today to talk about this very topic. Dr. Nasser, I'd like to start with you with a definition. What does sustainable patient care mean to you?
Well, thank you for having that discussion. With all the evolving healthcare landscape, the digital transformation that we have been hearing for the past few days, and the continued use of things that affect the environment, defining sustainability is very important, with a close watch on patient experience and quality as non-negotiable outcome. That's always the case, especially with the heightened consumerism at this time. Patients' expectations are different. So for us, the question to ask, everybody should ask, is how can we meet the needs of our patient at this time without compromising the ability of future generations of doctors, nurses, allied healthcare, and administrators to meet the needs of their patients and their needs in the future. So that's an important question, especially that at this time, patients want very accurate diagnosis. They want it faster, they want it closer to home, if not at home. So for us, when we looked at it, we defined our sustainability. There are three main domains that help us take care of our patient now without compromising the ability of future doctors and nurses to do it. It's the environmental aspect, it's the workforce, that's very important, and the social aspect, and the financial aspect. So on the environmental aspect, we all know that healthcare organizations emit a lot of carbon and use a lot of products that either emit or use. We buy a lot of products that really are not good for the environment. So we're healthcare organizations globally are the 5th largest carbon emitter. So there's a lot to work, and even within each organization, when we look at, for example, when we stop using desflurane, which is an anesthetic drug that we have used, we stop using it, or start reusing rainwater, or recycle waste, and there's so much opportunities out there. On the workforce, that's extremely important, because that's the most important, really, capital that we have, the workforce. Without the people, we're not going to be able to take care of patients. And less people want to go into healthcare. After COVID, many people left that profession, whether it's physicians or nurses. So we really need to nurture and preserve the workforce that we have, invest in them, as well as take care of them, as well as the health and well-being of our staff, while training and educating the next generation of healthcare professionals. So what we have done at SSMC, at the Three Shield Hospital, we are an academic medical center that provides a learning environment in everything that we do. We have more than 550 learners who are roaming the hospital and the clinics, whether it's physicians, nurses, allied health staff, or administrators, learning how to become who we want to become. That provides that framework, that culture, the learning environment that helps us frame the next generation. So the workforce is very, very important. Not to mention, with that in mind, the digital innovation that needs to have, that I think David will talk about, to improve the work efficiency, reduce the clerical burden on everybody at the hospital. And finally, financial, because if we don't have the money, we won't have the resources to do everything that we do. The cost of care keeps on going up, reimbursement keeps on going down.
And that's a real
problem. But you have to balance the book and invest. So that's a lot of things to do at the same time as we think about sustainability. But there are definitely opportunities to standardize practice, to reduce the number of tests done to get to the right diagnosis. And this all can be done with the power of data and AI and the digital framework that we all want to work with. So this, for us, in order to accomplish those three things within the domains that we elected to focus on, we need the agility of the leaders, think outside the box and be different. You need really a team of innovators and foster innovation along all the value chain of healthcare delivery, on the workforce, on operation, on a practice, on outcome. and you need partnership.
Yes.
Without partnership, you cannot do anything. So, and raising awareness among the public and the staff. So for us, this is what's important.
Thank you so much, Dr. Nasser, for that. And that brings me to the question to Ihab. What is the role of partnership and collaboration actually in developing patient care that is sustainable?
First of all, thank you very much for this event and for the invitation, and to be with a great leader in the same panel is really an honor for myself. So Dr. touched points on partnership, but partnership need to have alignment on the goals, and so we need to figure out what are the needs that that they are working on, what are their targets, and then we build strategies around how we can help. So if we talk about sustainability today, as Doctor mentioned, 4 to 5% of gas emissions comes from healthcare activities. Healthcare activities are not only at hospitals. Healthcare activities are outside hospitals as well, at manufacturing site, transporting equipment, patients, people moving around, etc. So the first partnership is to help them meet their target for gas emissions. So we need to be the partner of choice. They need to know that we are producing and we're manufacturing equipment with environmentally designed, conscious design. So the equipment that they're buying from us, we are innovating every day, trying to reduce the gas emission, the consumption of raw material, the consumption of electricity, etc. This is one part of partnership. So they have to rely on us to meet their targets by providing equipment that are less emitter of CO2, etc. The other partnership that we can help with is technology. Without technology, you cannot do anything today to advance healthcare systems. So what are the types of technology that we can provide as manufacturer? We talked about AI. AI is one part of it, but innovating in the technology, like I'll give some examples from GE, but other companies are doing similar stuff. But I can talk about what I know for sure with GE. Innovating in MRI, for example, having the MRI, to be done in much less time, maybe sometimes half of the time, with the new AI embedded in our MRI systems, right? So we can get the patient out of the MRI machine sooner, but with high image quality that doctor can rely on to do better diagnosis. Having said that, patient is out, so patient is happy. Patient's out sooner from MRI machine, and sometimes they are having trouble sitting in that magnet for so long. So patient is happy, doctor is happy, he's getting the right technology to help him do his work with more precision, And the environment is happy because that MRI is using less electricity, and they've done the patient in less time, which means that reduce more energy, right? So that's one example. So these types of partnership, have to be there, to address what are the needs. If I look at, okay, how can I go with, remote diagnostics? How can I do with putting systems to help the hospital measure how good they are, how efficient they are? This is another thing that we do at GE. We have command centers that is a horizontal that comes on all the verticals in the hospital, so you'll have live, it's like a cockpit. We can really help the hospital and the CEOs of the hospital view how their hospital is being managed, how efficient the in and out, and how can they reduce the stay at in ICUs or ICUs, etc. So all that will help them reach their target in sustainable healthcare, help their physician, besides the training and everything that we do, help them do better job, and easier job, reduce the burden of the physician, and help the environment. So it's this kind of partnership, I think, what Dr. Nasser was referring to, and this is part of what we do every day. We spend $2 billion as GE Healthcare in innovation, in R&D, and most of our innovation is today based on providing technology that is environmentally friendly, providing technology that can take burden off the physicians and help them do more with less, let's say. They have less time, they have to do more patients, so we need to focus on that. They are completely burnt out, I would say, and we need not to add to their burden by complicating the technology. We need to innovate in a technology that makes it easier for them to spend more time with the patients, and do better at their job.
Thank you so much
Sorry,
for that. David, would love to hear from you.
Yeah, I wanted to ask a question. So while GE is, developing these technologies, how do you keep the clinicians engaged without them feeling threatened that you are going to completely remove them from the healthcare equation one day?
So it's a very important question. Actually, today, at the beginning of the AI, we're thinking, okay, physicians having resistance, like, oh no, I don't want to rely on that. I want to rely on second opinion. Sometimes in mammography or even in some of my MRI exams, they refer to other physicians to take a second opinion, right? But they can use that through AI. So they were resisting the AI. Today, I believe that a physician with AI is a much better physician than a physician without AI. So AI will not replace the physician, but AI will replace the physician who is not using the AI. So you have, it's like, I was talking earlier with Dr. Nasser about our kids and how they use technology. I thought I introduced a lot of technology to the Middle East, from navigation systems and what have you, that were, utopia for some of the neurosurgeon, ENT surgeon, orthopedic surgeon. I thought I'm so advanced in technology, but I look at my kids today, they are much advanced, and they're much faster, and they know stuff more. So these types of physicians, they cannot be left behind, so we need to train them. So we need to put them at ease, like the technology is there to help you. The technology is there to give you a peace of mind when you are in doubt. And it takes all the repetitive actions away from you so that you can focus on what's more important. So if you talk about segmentation, if you talk about, pulling all these reports on looking at history, or, technology can really bring it in. I'll give one example. I know maybe I'm taking a lot of time, but today to integrate this technology so the physician will not feel that he is replaced, we have a click on a button, like you click on one of our, review stations, and everything is done in the background. That button will go back to select, okay, for that exam, do I have an AI application that can support the doctor do the diagnosis faster, segments everything, and give suggestions? He doesn't have to worry about anything. So click, everything goes in the background, it comes to the workstation. He feels more empowered. The more we talk about that, the more our doctors feel, okay, that's something to help me, not to replace me.
So as a physician scientist, one best way, because I remember being engaged in developing tools for ultrasound, for echocardiogram at Mayo before coming here, and engaging the physician partners early in developing those, or in the designs of those tools will help, because now they believe it and they will use it.
Absolutely.
It's a change management, but the engagement part as early as possible with the clinician helps in that regard.
Thank you.
This is back to the partnership. This is exactly, we cannot do it alone. I cannot invent something as GE, no matter how good I am. I cannot invent something that nobody would use at the end, or they are not seeing the value of it. So we are there to work together and create something together.
Thank you for that. Yeah, so much. Very valuable. I want to kind of go with the same question, David, and ask you, how can healthcare providers think about integrating digital sustainable solutions into their existing systems? What are some of the examples that you see would make the biggest difference, especially when it comes down to sustainability in your experience?
In terms of technology adoption in healthcare, I think if you look at Porter's value equation, where he talks about clinical outcomes versus plus patient experience over cost, and if you overlay what digitization and how that can make the healthcare system more affordable. Dr. Nasser talked about rising costs, et cetera. I think you covered a lot of a lot of the opportunities on the patient clinical outcome side of things. Once you put in a proper EMR, you start to use the data meaningfully to come up with predictive outcomes. You help the doctor with his decision making. You can create better clinical pathways. You can improve the patient experience as a result of many of those initiatives. You can also adopt other technologies to make the patients feel more comfortable in their surroundings, etc., doing healthcare at home and then the likes. If you go below the line to cost, there's a lot of opportunity there. If you look at one of the big challenges we've had in healthcare is we've never been able to introduce the Baumol effect. GE is still developing these things, but we've never been able to replace people. And the biggest cost in healthcare, as a provider side, is people. But if you look at the technologies that are coming in today, if we've got a proper ERP in place, to manage all of our back office systems. If we bring in coding systems and we adopt AI in that regard, we're able to reduce the number of people that is required on the back office side of the healthcare equation. And this will in turn reduce cost in time. Obviously there's a big upfront investment. To be able to put these systems in is not cheap, but eventually you'll be able to reduce the cost. And as a result, if you're able to improve the patient outcomes, improve the patient experience, and reduce the cost because of the adoption of digitization, you're going to improve the value equation. You're going to improve what the patient gets in terms of, healthcare outcomes for his buck.
I love that. And I'm going to ask you one more question, and then I'm going to go back to Dr. Nasser to hear your opinion, and Ihab as well, which is, how is your organization tackling public awareness and education on the different areas of sustainability?
So I've only recently joined the NMC, and we are in the process of developing an ESG strategy. But as Dr. Nasser said, there's a lot of opportunity for healthcare to contribute to becoming carbon neutral. We're big utilizers of electricity as an example. So if we can buy electricity that is less harmful to the environment, such as nuclear energy, which is available in Abu Dhabi, if we can adopt solar power, et cetera, if we can reutilize our waters from our air conditioning, et cetera, we're able to contribute quite meaningfully to the environment. The other thing that we're a big user of is gases. So make sure that we have closed systems, that we put in proper clinical pathways in the way that we use gases in our theaters, et cetera. So we're currently putting together our ESG strategy, but there's a lot of low-hanging fruit, so to say, that we as healthcare providers can work on. We're big users of plastic. We give plastic bags with our drugs, and we can replace it with paper, et cetera, et cetera. So there's many initiatives that we're working on to become more sustainable going forward.
Thank you so much for that. Dr. Nasser, I'd love to hear from you about educating the public about sustainability in specific.
For raising awareness, it starts with a clear vision on what sustainable healthcare means for us, for SSMC. And then we right away have to really communicate that clear vision to the team. So what we did a few months ago, Carol Millward and I, the Chief Financial Officer, we both had the same vision on what needs to happen for sustainable care for a healthier planet. So we decided on what are the most important elements of the work that the team has to do. Then we engage 20 plus members of our leadership, whether it's leaders or managers, in the different verticals or cross-functional teams. And we right away had a captive audience of 20 plus team members who believe in sustainability. The first meeting we had was a lot of fun because we had no idea how much each team has been doing along with their teams, whether it is the water bottle or stop using papers and everything else. So once you empower those teams to disseminate what sustainable care means for us, then you have a lot more people. They become a role model for their families, for their communities. Then we did a town hall meeting. We did an explicit town hall meeting in September. Everybody was invited, where we talked about the why and what will happen if we don't do it. And half of the town hall meeting was about education and training on sustainability. We partnered with the Geneva Sustainability Center. We went to the master class. All members of the team went to the master class. We're creating online modules for our staff with special module for the procurement team. And then we did an environmental day on September 21st. Everybody attended. It was in the foyer of SSMC. It's a large area where we had green champions. People displayed what they have done for sustainability. Patients were there, visitors were there, and we had partners. So we had partners with adhere, we had partners with Emirate Nature, WWF, we had partners with, and now we partner with Alliance for Climate Action. So we believe that empowering our staff to be our first spokespeople for sustainability help disseminate the message. On the patient side, our messaging has been predominantly raising awareness on early detection and prevention of disease. Could that helps the cost that we talked about in the denominator of the value equation with a lot of those, like nowadays if you pass by SSMC at night, it's lit in pink. It's Breast Cancer Awareness Week. So
thank you so much for that, and it's participating in health summits like this as well to educate the public about this, which is very important with industry leaders. Ihab, I have a similar question to you, but with a slightly different angle. Do you do any kind of work specifically to the public that is maybe social media? Is GE Healthcare on TikTok?
yeah.
Are you doing any kind of work to reach the new generation as well to understand how to adopt more sustainable lifestyles?
You cannot do anything without marketing, and our marketing manager is sitting somewhere here. So we need to market what we're doing, but for a reason, right? So I love the work the gentlemen are doing. Cleveland Clinic as well. They have the annual report about sustainability. Both organization as well as Cleveland, we do have the same thing. That's why it is important that we share the same value as manufacturer of medical equipment. So we annually issue our sustainability report. Actually, it was just launched in September, where we measure our achievement and we report our achievement. We set our goals. We have our climate council in the company that works across functions. They are empowered to set targets and to follow through on these targets. And we do participate in events like this, and we sometimes write reports about healthcare, sustainability in healthcare. I did an article in one of the magazines here. So it's important for the patient, for our kids, to know that while we're exactly what the doctor, the United Nations mentioned that as well, right? So what Dr. Nasser said, like while we're doing all that for our generation, for our patient now, we need the new generation to know that we're taking their future into consideration. We will not impact their capabilities to meet their needs. We are, as well as many other manufacturers in the healthcare, responsible companies, that are transparent in the way they work. And I must say, we are we have the luxury to live in the UAE, and UAE from government, they have set target for sustainability target for all sectors, including healthcare. DOH is following through, and I think all organizations, all private and public, are participating into these initiatives, and this is what makes us comfortable, for the future. And this needs to be marketed more and more, and we're trying our best, I did not talk about patients because we reach the patients all the time with our technology, etc. Our first customer, really the hospital, to see that we are sharing the same value when it comes to sustainability.
I want to bring up an important point because we didn't talk about the DOH guidelines, the Emerald guidelines for sustainability. And it's important, we had just submitted, I'm sure David submitted their KPI as well. But we don't need to do it because of the KPIs.
Yes.
We really need to do it because it's the right thing to do.
Right.
Absolutely.
And if we do the right thing, there's no need for KPI.
It's voluntarily so far,
I truly believe when you have to do this, this is very important to be able to meet the needs of our patients now and in the future, irrespective of what change is happening. So that will take care of KPIs, honestly, if we do the right thing.
Thank you so much.
100%.
Thank you so much for each of you for this very valuable discussion. I really, really appreciate it. We've all benefited, and really looking forward to all the changes and the benefits that we're going to see from adopting more sustainable solutions.
Building a resilient healthcare system, that's the most important.
We need perseverance.
Yes.
Patience and perseverance to do this.
Absolutely.
Thank you so much.
Thank you very much.
you.